Thanks, Tori, for this opportunity to share this conversation with Robert Grossman, CEO of NYU Langone Health and the Dean of the Grossman School of Medicine. NYU Langone Health is one of the nation's premier academic medical centers with a mission to care, teach, and discover through an integrated academic culture devoted to excellence. Today, Dr. Grossman and I will chat a little bit about the strategic direction that he's taken the institution on since starting in 2007. Thank you so much for being here today.
My pleasure.
If we could just start off by having you tell me a little bit about your role as CEO of NYU Langone and Dean of the Grossman School of Medicine. Each one of these would be a massive job in and of itself. Tell me about that intersection and your approach to being CEO.
What happened in 2007 is we decided to make a firm commitment to integration of the school and the hospital. By doing that, we decreased the number of interfaces that had to be navigated between what's traditionally a dean role and a CEO role. And so we blew up all the interfaces. The point was to create a totally integrated academic medical center while decreasing our cost structure and improving our efficiency. The question you asked of what does the dean and CEO do and how do I think about it? And I would think about it as a conductor of a great symphony orchestra, and I'm trying to harmonize all these soloists. And that's tricky, but in order to get really beautiful music, everybody has to be harmonized in an integrated academic medical center.
What is the reason that you're really focused on streamlining things?
So it comes down ultimately to outcome. Institutions that focus on quality and safety and have the best outcome are really the most efficient, meaning they get the patient in and out of the hospital in the most efficient manner because every complication decreases your efficiency. If they can't go through radiology efficiently, if they can't get their blood work efficiently, all of those things ultimately increase on the inpatient side the length of stay. The efficiency actually speaks to respect for the patient.
So I know you trained as a clinician. Tell me a little bit more about your background. What did you gain from medical school? And how does that inform what you do on the business side? Why do you think we don't see more clinician CEOs out there?
Number one, physicians are reluctant to take on CEO responsibilities where the duration or tenure of your title is limited by the performance of everybody else, right? You could be a great CEO and theoretically the institution doesn't perform well and you don't have tenure of the CEO position. Number two, doctors are very risk adverse, and that's good. As a patient, I want a doctor to be risk adverse. CEOs have to make business decisions with some ambiguity, and doctors want certainty. And so it's a different mindset. And being a CEO isn't being an accountant. It's actually having a vision and trying to execute a vision.
Actually leads me back to that initial question, which is, what did you learn in medical school that's led to your success in business? I'm sure it's not just the dedication in studying, but also kind of this navigating an ecosystem and working with other people as well.
I really liked the science of medicine. I was pretty much a sponge. And that actually helps me in this job because, even though I was a neuroradiologist, I have a pretty good understanding of medicine and surgery and what it means to take care of patients inpatient and ambulatory. And the other thing is if you're going to do well in medical school, you have to be pretty disciplined. And in this job, you have to be very disciplined because every half hour I'm changing gears and you have to be able to always be on top of things because things go so rapidly. And then medical school and medicine teaches you a lot of humility. No matter how much you know, there's a lot more that you don't know. And in running a business, I think one of the most important aspects of being a CEO and a leader is humility, because without humility, you can't learn anything.
I want to turn to leadership and training for a minute, especially in this academic medical environment. These combination systems have been kind of late to embrace leadership development. Is there a lot of potential for academia and medicine to really push things forward?
Leadership training is critical, and medicine has been really late to the starting line here. Business has been doing it for years. General Electric had this whole institute at Croton on the Hudson where they trained all their leaders. So in 2018, we developed what we call the NYU Langone Leadership Academy, which has programs for all different levels of leadership, both for staff, faculty, executives, et cetera. We've trained over 1,300 employees, and we have over a 90% retention rate in those employees, and 21% have been promoted into higher leadership positions. But it also is a way to add value to the people who work here. By investing in the people, we invest in ourselves.
Okay, and as we wrap things up, is there anything else you want to cover?
The other thing I would say is this is a very unusual health system. There's no system in the United States that has the quality metrics that we have year over year over year. The lowest mortality rate in the country, the lowest readmission rate in the country, lowest length of stay. It says a great deal about the people who work here and how focused they are in producing the highest quality of medicine and patient safety and clearly the best outcomes.
Dr. Robert Grossman, thank you so much for taking the time to join me here today and share a little bit about the groundbreaking work that NYU Langone is undertaking. With that, I'll hand it back to the STAT editorial team to wrap up this First Opinion episode.